I'm Dr. David Karli with Karli Centre and Gray Ledge Technologies. So as patients, you face difficult decisions every day. But I want to talk about one that's particularly difficult and one that I got to address from day to day with patients all the time. And that is, if I have arthritis, should I do a joint replacement or consider a cell therapy, a non-surgical stem cell type of treatment, what we specialize here at the Karli Centre. It's a tough decision, and the way we address the problem is usually to say, let's go through the pros and cons of both, because there's not a right nor wrong answer, and it really depends from patient to patient which is the best option. So with surgery, there's a sense of permanency. The bad part comes out, a new part goes in. That's a more long-term type of solution depending on what you want to get back to from a lifestyle standpoint. You want to get back to walking and day-to-day activities or running marathons. Two totally different things. We have to take that into consideration. There are risks. It's a major surgery, anesthesia, all those types of problems. But the biggest issue is this. As a patient, if you go the joint replacement route, if everything goes perfectly, you say, man, I wish I would have done that sooner. If it doesn't go perfectly, and they don't all go perfectly, then you're kind of stuck. You can't turn around and come back. And that's the downside of surgery when it doesn't go perfectly. On the other hand, non-surgical, a cell therapy type of treatment, when we take that approach, what's the upside? Well, obviously, no surgery involved. We use your cells, put back into you. From a safety standpoint, your cells can't hurt you. So the risk is extremely low. So that's a big positive. The downside to cell therapy is will it work enough to make you not want to do the joint replacement? So what we try to do is handicap the likelihood of success. We view it almost like a return on an investment. What's the likelihood you're going to get your outcome investing in these types of therapies? And we know enough from research and doing this for many, many years that we can kind of get us a sense for who's going to do best and which are more iffy or long shots with regards to getting that outcome. Okay, so we need to take that into consideration. If you have good motion in the joint, and it's not a mechanical problem, but a symptom problem, symptoms are the limitation, then often cell therapies are still a reasonable option, and we'll take a look at that. So we weigh the pros and cons of surgery versus non-surgery, considering lifestyle, height, weight, sex, any other medical problems that you might have. We take all these things into consideration to make the best decision for you, knowing that there's not a right nor wrong answer. Obviously, my job is to try to keep people away from surgery. That doesn't mean I'm anti-surgery, and there are situations where surgery is appropriate.